Yeah, hello. Hi, everyone. My name is Dr. One. I want to believe that you're all doing great. I'm here to talk about antibiotics. Reason being that I've had so many calls from students and my follower on my platform who wanted someone or me personally to give lecture on antibiotics. So I won't take so much of your time. I will try to summarize things as much as possible. I will also try to avoid using technical words because I know some young students who don't yet have that experts or expertise may find it a little bit challenging in understanding me. So I'm trying my best to make sure that I choose some soft languages and also way of speaking to make things easier for you. So having said that, let's go straight into the point. What are antibiotics? What are they meant for? How should you take them? Should you take them with alcohol or not with alcohol? Should you take them with food or not with food? And if you have to take them with food, should that food contain lipids, fat, protein, or what? So these are some of the things that I will try my best to make sure that I explain to you all such things, and also go a step further by explaining to you which antimicrobial can also create adverse drug reaction. For instance, we have what we call AFib. AFib stands for atrial fibrillation. And also we do have the QT prolongation. It's also another hot potato in the Western world when it comes to drug designing. I'm coming from the industry. It's not just talking literally, but also from practical point of view. I've been in the industry for quite a good number of years, and I'm also presently working in the hospital right now. So I know what I'm saying. So having said that, let's go straight to the point. An antibiotic is a type of antimicrobial substance active against bacteria. It is the most important type of antimicrobial agent for fighting bacterial infection. Now, bacterial infections here means a lot of things because we have various types of bacteria and also various organs. Take, for instance, you might have endocarditis. So endocarditis obviously affects the cardiac organs. So antimicrobial for that part of the organs are not the same as the one meant for the respiratory organs. So that's what I'm saying. That's the meaning of bacteria infection. Now, antibiotics medication are widely used in the treatment and prevention of such infection, with the one I mentioned a while ago. They may either kill or inhibit growth of bacteria. So those are the two things that they do. So we call them kind of antimicrobial with bacteriostatic activity, and the antimicrobial which are bactericidal. So those are the two words, bacteriostatic and bactericidal. So those are the key things that you gotta know. Now, so having said that, I always have this statement which I make always when it comes to antimicrobial. And here it goes. In many cases, the preferred antibiotic is no antibiotics. Again, in many cases, the preferred antibiotics is no antibiotics. What do I mean here? That is, you should not go and start using medication without the consent of a healthcare professional. That proactive behavior of using medication should stop. If you don't stop it, you risk creating more trouble for yourself, especially those of you consuming food like agri chicken or agri fowl, what you put it the way you want to put it. They raise those chicken with antibiotics, especially the tetracyclines. So meat have some dose in your system. So if you are already someone eating meat and all those things and the meat sold in supermarket, then rest assured that you risk finding yourself in trouble down the road. So that's it. Now, the antibiotics are classified in two groups here, as I will put it. In Europe, we call them first line and second line. In the US and Canada, we call them first choice and second choice, meaning that first choice is the one that if you go and see any health care specialist, prescriber, they will definitely put you on that one. Reason being that it is safe. And now, second choice, or what you call second line, are those ones that they might create you some hassle in the course of using them. So we use them only when the first choice or the first class are not available. That's why we move to the other one. Or call it, or say on extreme cases, yes, that one also can be done. So essentially, we have prefer antibiotics in community. So in that community now, I choose to classify them into three groups here. So we have respiratory infections, and the duration for that one should be 5 days. Now, the frequency depends on the prescriber, not me. That's if I'm to prescribe it, I will tell you the frequency. Is it 4 times a day, 3 times a day, twice a day, or once a day? That's the meaning for what I'm saying here. Same thing also for UTIs, that's a urinary tract infection. Same thing for skin and soft tissue infection. Now, having said that, I'll give now also the respective molecules. So for the respiratory infections, we have the amoxicillin. Be careful here because the amoxicillin here is just that one molecule. There's no combo here, because I know you asked me about what about augmentin. Augmentin is not just amoxicillin. It's a combination of what we call beta-lactamase inhibitors. And I'll also talk about beta-lactamase inhibitors, what they're meant for. So technically, it contains clavulanic acid or ticarcillin. So that one helps to protect that ring there, the beta-lactamase ring. So that's what essentially it does. Now, those beta-lactamase inhibitors, there are actually 7 in number. So you have the clavulanic acid, which I said a while ago. You do have the sulbactam, you have the tazobactam, you have the avibactam, you have the dorobactam, you have the relbactam, and verbobactam. So those are what you have on the market currently. Now, coming back to what I was saying before, the 3 classes which I classified them before. So we have under respiratory infection, we have the amoxicillin not combination, we have the doxycycline, we have the penicillin V, and then for the urinary tract infection, that's the UTI, we have the nitrofurantoins, which is exclusively reserved for the lower urinary tract infection. We have the cephalexin, we have the trimethoprim, and we have the phosphomycin. In case you don't have the nitrofurantoin, that one can be used. And for the skin and soft tissue infections, I would recommend also flucloxacillin, cephalexin, doxycycline, and the limicillin. That one is meant for acne of the face. So those are the 2 drugs that are used for that purpose. And so now coming back to the antibiotics to be avoided in first line community, we have the augmentin. Yes, I'm serious about this one now. I know they'll ask me about why do you want to use augmentin as a second choice? Oh yeah, because it is a combo. When it has a combo, there are chances of customers, or call them consumer or client, developing allergies. We don't want that to happen. Not only that, is also what we call AFib. AFib stands for atrial fibrillation, just like the QT prolongation. So all those things, we don't want them to happen to you. So that's the main reason why we classify co-amoclav or clavulanic acid and amoxicillin combination, which goes now into the second choice, not the first choice in this case. So safety is number one. Another one, it is C. difficile. There's that high risk of patient developing it on that medication. So that's the two reasons why we classify them as second choice. Or say in Europe, we say to avoid them. Now, in that same family, we have the cefaclor, we have the cefixime, we have the cefuroxime. They all have the C. difficile. So that's the common headache with those medications. Now, the next one, we call them the quinolones. Now, the quinolones also have the same trouble. An example of the quinolones are the levofloxacin, the ciprofloxacin, the oxfloxacin, and the amoxicillin. So in the US, we call them the Floxi. That's the easiest way to remember. When you hear about the quinolones, remember the Floxis. So they do similar things. So they have the C. difficile also, and they have the QT prolongation more pronounced with respect to what I said before. In this family of antibiotics, QT interval is a big issue here, and they also have, but the good news is they have a lower seizure threshold as compared to what I will say next. Then the next group now is what we call the macrolides. So the macrolides, another way to remember it is the mycins. So we have the clarithromycins, we have the azithromycins, and we have the erythromycin. We will talk about this family of drugs because it has a lot to do with medication interactions. So it's a very important thing here. I'm going to make a next video for this one to explain further. Same thing also for the quinolones. Quinolones has what we call rhabdomyolysis. So I'll also create another video to explain to you further about this. Thank you so much, and if you have any trouble, please feel free to get back to me. On my page, there's my phone number there. On WhatsApp, there's my email. Please send me all your questions. I'm here to help you. As usual, please don't get lost. Feel free to contact me. Like my page also, and put more likes as much as you can. I'm happy. And again, thank you. I'm Dr. Wan. Have a wonderful evening or a wonderful day. Bye.